Okay, there's so much paper right now. I'm
Yeah.
drowning.
Thank you. I know.
Okay. Cool. Thank you.
So you know.
Supposed to be talking to her today at 6.
Yep.
Say hi.
Okay.
We should start.
I think so too. Can we shut the door, please? Okay. Great. Good afternoon, everyone. Today is Monday, June 24th, 2024, and we have convened the Board of Health for the City of New York and the New York City Department of Health and Mental Hygiene. The time is 1:04 p.m. I will now call this meeting to order, and I will start by conducting a roll call. Are all the following members present? Please give a response. Dr. Angelo Acquista, Mayda Galvez, Dr. Mitch Katz, Dr. Simona Kwan, Dr. Michael Lindsay, Gail Nailwith, Dr. Judith Salerno. Thank you. Thank you so much. We will start with approval of the minutes from the December 19th, 2023 meeting. Let's do it now.
Sure.
I believe you have received a clarification of the minutes, which will be attached to the minutes. In addition, the minutes were corrected to accurately reflect the members who were in attendance at the meeting. Are there any further corrections to the minutes?
No.
Okay, if there are no further corrections from the December 19th meeting minutes, can I have a motion to approve? Can I have a second?
Second.
Great. All those in favor?
Aye.
Great. Opposed? Motion passes to approve the minutes. So I'll start with a few remarks before we get into the meat of the meeting. Before we launch into it, I'd like to share a few general updates with the Board of Health and with those tuning in. I'm pleased to report over the last several weeks, we've issued two major reports related to mental health in New York City. The first is a landmark state of mental health survey in New York City. It was released on May 31st, the last day of Mental Health Awareness Month. The report is really the first of its kind, exploring mental health before and after the COVID-19 pandemic. And it was based on a set of surveys explicitly designed for mental health, as opposed to mental health questions embedded into other survey instruments, which allowed us to not only survey a much larger group of New Yorkers, but also granularly get to other populations that we don't get in our normal community health survey or other youth-focused surveys. It includes children all the way to adults, and in it we also provide policy recommendations in response to gaps in care delivery, and I think it offers an important baseline for this post-pandemic era. And the top line is that what we see is actually quite some improvement overall, but extreme gaps and inequities as expected in access to care, in stigma and discrimination and awareness. And lastly, I think one of the most important findings is that young people are really hurting. 50% of New York City teens reported having moderate to severe depression, 50%. So that is a remarkable finding. You will see us continue to program into this space, whether it's digitally or in person. Teen Space is one of the biggest things we've done in this space, but we've also expanded school-based mental health centers, both through our public hospital system, but also well beyond it. And so there'll be more to come as we announce efforts in that space. And then just last week, we released a supplemental report on the impact of social media on mental health. The data came on the heels of the Surgeon General's, announcement of his intent or his desire to put forth warning labels on social media content. Obviously, that would require congressional approval. This is the first data of its kind, again, to report locally gathered and local impacts on New Yorkers as a harbinger for the rest of the nation and beyond. We surveyed over 20,000 parents and children. So we also have an ability to look at both key population stakeholder groups in our youth mental health crisis and social media, and also to say where are the gaps between perception around use and actual impacts of use. And as you can imagine, there's some divide. There are inequities in these data as well. But I think an important touchstone for our work going forward. Second, I want to mention exciting progress on our Healthy NYC campaign. As you'll recall, that's our citywide effort to improve life expectancy and health span as a organizing focus for population health and public health in our city, bringing together all of our city partners as well as non-city actors. We launched our Champions Initiative on June 11th, which at an event with the mayor, with the deputy mayor at Gracie Mansion. We brought together representatives from academia, philanthropy, payers, providers, private sector, organized labor, even cultural institutions to say we are champions and committed to this long-term effort. We, as you know, we also worked with City Council to pass a local law to ensure that Healthy NYC is a permanent feature of our planning. Going forward, we'll be following up with all of these partners in the coming weeks and months to drill down on specific commitments that they'll make. And looking ahead, we'll have we're having a symposium on Healthy NYC in the fall at some point. Now, on to lastly, the topic for today's meeting. And it comes on a pretty important day. 2 years ago today, the US Supreme Court ended Americans' constitutional right to safe and legal abortion care. For as much as I can say about how terrible that decision was, I also think it reminds us and reminded us that in order to protect our rights and to fully realize our rights, we needed and we need to continue to adapt and evolve and even expand our services to meet the moment. And that's precisely what we've aimed to do over the last 2 years since this announcement. While dozens of other states have started to ban or deeply restrict reproductive freedom, the city has continued to strengthen and expand access to care and supports for people seeking abortion and reproductive health care. Some of the highlights include the launch of the Abortion Access Hub, which has served more than 5,000 people since its announcement in 2022, nearly 800 of which are coming from states outside of New York to seek abortion care here in the city. The health department became the first public health authority in the country to offer medication abortion at its public health clinics. And to date, since its implementation in January 2023, we've served over 1,000 patients with medication abortion services through May 2024. Health and Hospitals became the first public healthcare system to announce telehealth access to abortion care delivered to their home by mail. We announced the Sexual and Reproductive Health Care Bill of Rights, further enshrining the right to reproductive health and abortion care in NYC. And this is all over and above protections that the state has made, legislative action that they've taken to protect abortion patients and those seeking to access abortions in our state and our city. The city separately adopted a law prohibiting the use of city resources to cooperate with or to provide information to any individual or out-of-state agency or department that would confirm, deny, or identify any person associated with an abortion that has been lawfully performed. Lastly, we became the first jurisdiction in the country to initiate a provider convening, basically bringing together all of the licensed abortion providers in our city in a collaborative space, the same that we would do with any other health service in terms of a learning collaborative. We created one for abortion care, which is the first of its kind in the country, in order to work together more collaboratively, to bring it out of the shadows and normalize it in healthcare, but also to find opportunities to partner and to improve services. So it's within this context that today's meeting is happening. We today are going to be discussing additional steps to bolster privacy protections for people who receive abortion care in New York City. In ongoing conversation with providers, we've reviewed the information we've collected to further anonymize the information that we gather on abortion services. We've made changes, including eliminating the collection of data such as date of birth, birthplace, marital status, previous pregnancies, and attendant name, all of which were data that were collected since we began collecting abortion data in the late 1940s in New York City. I want to very much thank the providers for their input and to assure them that we will seek out and continue to seek out every opportunity for their engagement and input and dialogue. And as we, again, continue to adapt and evolve to what appears to be a shifting legal, regulatory, and judicial landscape that is threatening access to care in our country. So I hope today's discussion reinforces our commitment to ensuring that services are not only expanded, but protected, and that we are taking proactive measures to ensure privacy and safety and dignity for everyone seeking abortion care in New York City, whether or not they reside in the 5 boroughs. So with that, I will turn it over for the discussion on our first item. The first of our 2 items on our agenda are proposed vital statistic form changes on forms VR 17 and VR 18, and the proposed resolution to amend Articles 203 and Article 205 of the New York City Health Code. And our presenter today is Dr. Gretchen Van Wy, who's our Chief Epidemiologist and Deputy Director of the Center for Population Health Data Science, and the Assistant Commissioner for the Bureau of Vital Statistics.
Thank you, Commissioner. Good afternoon. I'm here with you today to propose amendments to Articles 203 and 205 of the New York City Health Code, and also form changes that are highly related to those sections of the Health Code. As background, as the Commissioner noted, in the 2 years since the Dobbs ruling, the state and the city have worked to bolster the security of abortion and abortion data. Since 2022, the state and city have adopted laws to protect patients seeking abortion care. And in June of last year, the board amended Article 203 of the Health Code to ensure the same strong level of protection for confidential information about terminations of pregnancy reported to us at the department. In December, the board approved abortion reporting form changes to update medical terminology and eliminate certain data points to further increase confidentiality protections. Those were done through working with providers and asking for their inputs. Now, the current status are that the data remains safely secured in our electronic systems, which meet stringent federal, state, and city security requirements. And the data remain important to development of some of our interventions. However, despite these protections, the political and legal landscape continues to change. This changing political landscape poses a potential legal threat to the security of our data and to abortion patients and providers. It has prompted us, even more so than is usual, to continuously evaluate our own rules and operations. Since December, the department has worked with many external partners to better understand their evolving concerns over terminations of pregnancy reporting. Providers and advocates have expressed their own evolving and continuing concerns about privacy issues and administrative burdens related to reporting requirements. This has prompted us to again reevaluate the process. Concerns were also raised about requirements rather than options for the disposition of a product of Conceptus. Based on the evolving legal landscape since we last came before you, I'm before you today with 2 proposals for your consideration. The first is regarding changes to forms for reporting terminations of pregnancy, and the second is regarding amendments to Health Code sections 203 and 205, which relate to these. I'll ask for votes on both at the end of the presentations, as they are interrelated and they really make the most sense when looked at together. First, I will review the department's proposed vital statistics form changes. As the Commissioner mentioned, the purpose of these proposed form changes is to address concerns raised by providers, to increase protections and confidentiality of data by minimizing the identifiers of patients and providers and collecting fewer variables on the VR 18, which is the induced termination of pregnancy, and the VR 17, which is the spontaneous termination of pregnancy form. We also propose to collect minimally necessary data to conduct surveillance and to carefully tailor the information we collect about both patients and providers. And finally, as always, we want to ease the burden of reporting by broadening, in this case, by broadening the scope of certifiers, which will allow additional people at a practice to enter and certify data. So instead of going through these form changes one by one, as I often do, there are a number. So I'm summarizing them in a table, which you see here. These primarily pertain to the VR 18 form, which is the induced termination of pregnancy form. The last one also applies to the VR 17 form. So in summary, we propose to replace the date of birth with age, to remove the patient's birthplace, to reduce the information collected on usual residence, eliminating state or country for people coming outside of New York State, discontinuing zip code collection for New York State residents, and keeping the zip code for New York City residents, but allowing for an unknown option. We also propose to remove education level, reduce the detail requested about ancestry origin, remove the marital status variable, remove the date of last normal menses beginning, remove previous pregnancies, remove contraceptives provided at the time of termination, and remove the signature, name, address, and license number of the certifier, as well as the attendant name at termination. The last change that we're proposing would be to add the facility administrator box to the certifier types, which would allow an administrator who's vetted by the agency to actually do data entry into the eVitals system. So in summary, this is the form as it exists now. This is the form that was approved in December. Here, I'm just highlighting in yellow the areas of the form that would be addressed. This is why I showed the table, because there are a lot of them. And then this is what the ultimate, if approved, resultant form would look like for the VR18. And then in parallel, the stop certificate, which is the VR17, would have changes just to that piece at the bottom that I referred to, which is just really allowing for an additional type of person at a practice to do the data entry and certification and easing provider burden. Next, I will turn to the proposed amendments to Health Code Articles 203 and 205. Again, in response to concerns that have been raised by stakeholders, we're also proposing health code amendments that continue to prioritize the health and safety of New Yorkers and people who give and receive care here in the city, the advancement of equity, health, and safety at the population level through the parsimonious collection of data, through data analysis and data-driven intervention, and of course, flexibility and efficiency in our own operations and those of providers as we adapt to the current and emerging threats to reproductive health care in this legal landscape. The amendments proposed today would, one, allow a designee of a licensed healthcare provider to report a termination of pregnancy. This reduces burden on providers, and this is in alignment with the form change that I just presented that goes on the VR18 and the VR17. Two, would make disposition of a product of Conceptus optional rather than mandatory via changes to several sections of Health Code sections 203 and 205. Just to be clear, disposition means like a burial or a cremation. The way the law stands right now is that one of those two is required in cases where there's a termination of pregnancy at 24 weeks or more. This is inequitable, it's very costly, and it's something that providers and others have come to us to say is inequitable and that should be changed. And then finally, we're proposing to make the language in the code gender neutral by changing the word woman to pregnant person. Now I invite any questions that you have and discussion about these proposals.
Great. Yeah, at this time I'll take questions. So Dr. Salerno.
Yeah, I was just, thank you for this and the presentation. I was wondering if this is in any way at odds with any federal statutes or, and, you know, where if there were a challenge to this, you know, what might be called into question.
So I don't think it's not in conflict of any federal statutes. I think it's in alignment with New York City and the New York State vision to make sure that New York City stays a safe place for abortion. I don't know if there's anything else.
I was just going to say, if you're speaking to all of the amendments that we're making, or is it just the form that you're asking about, or the concept is all of them? Yeah, these are not preempted in any way by federal law or state law.
Okay,
carefully at that.
great. Thank you.
Yes, New York City is an independent vital records jurisdiction. It's one of 57 in the country, so we make our own rules in this matter.
Thanks.
And looking at the proposed certificate of induced termination of pregnancy, say physician needs to contact this patient, I don't see the phone number or the.
So this pertains to what's reported to us as the department. This has no bearing on what the physician chooses to keep in their own electronic medical record system and their own filing, in their own record keeping system.
You may
Dr.
have,
Lindsay, so I'm just recognizing you for the record.
yeah, you may have mentioned this, but just to clarify, what happens with the terminated fetus?
Sure. Currently, the rules state that if there is a termination at 24 weeks or more, people need to call a funeral director, have that remained, and then pay for and conduct either a burial or a cremation. We learned that this is very costly and very burdensome. This was actually a huge problem during COVID for people experiencing unexpected deaths. And so this is a matter that has been brought to us, in the recent past as something that creates an undue burden that's really inequitable for the people having these experiences. The last thing that they're expecting is that they're going to need to pay for a funeral or a cremation. I think that's also a big shock. It's very traumatic to people. And this is a matter that we don't think the government needs to be involved in. This is something for the patient and their provider to talk about.
Dr. Galvez?
For that presentation, it appears that the form is significantly reduces time burden on the healthcare professionals.
Yes.
Appreciate that.
Okay, good.
Any other questions this time?
I had my question answered.
Okay, very good. That's the best kind of question. So now we will move to a vote on the vital records form changes. May I have a motion to approve the proposed vital statistic form changes on VR 17 and VR? Second?
Second.
All those in favor?
Aye.
Very good. Motion passes unanimously. And now we will move to the second piece of the proposed health code amendments. May I have a motion to approve the proposed resolution to amend Articles 203 and 205 of the New York City Health Code for publication and comment? Okay, Dr. Krista, a second.
Second.
Great. Dr. Lindsay, all those in favor?
Aye.
Great. The motion passes unanimously. Thank you very much. Dr. Van Wy?
Thank you.
Okay. Now we are shifting gears. And the final item on our agenda is the proposed resolution to amend Article 89 of the New York City Health Code regarding mobile food vending for publication and comment. Our presenter today is Jeffrey Hunter, Assistant Commissioner of the Bureau of Environmental Health Administration. And I'll turn this over to Mr. Hunter now.
Great. Thank you very much, Commissioner. Good afternoon, all, and thanks for the opportunity to present to the board today. Sorry. Oh, okay. Okay. So these proposed amendments to Article 89 aim to simply align the health code with the recent law relieving some administrative burden for mobile food vendors. Under local law 52, a few application requirements are loosened. So first of the proposed changes include the mobile food vendor license and permit applicants are no longer required to obtain tax clearance certificates. So these tax clearance certificates verify no taxes are owed by the individual. A certificate of authority to collect sales tax is no longer required to obtain a food vending license, though the requirement for such a certificate remains in place for those seeking a food vending permit, recognizing that it is the requirement of the permittee, so the owner of the unit, to pay taxes, whereas a licensee is a worker of a unit. And as stated previously, this proposal would align the health code with local law 52. And that's the extent of my proposal.
In this case, we have a local law which was passed, and now we are aiming to align our health code to be consistent with it. So we are asking the board to approve the publication for public comment of Health Code 89.11 to remove these requirements for mobile food vendors. And of course, this is part of a wider discussion around how we both improve the efficiency with which we support our food service establishments, but also adapt to a changing landscape where we're seeing an increased proliferation of mobile food vendors in our city, particularly post-pandemic. So first, I'll take any questions. I'll open it up to the board. Any questions on this motion?
No, just thank you for the presentation.
Okay.
So what it's saying is, if you can clarify for me, that they don't have to pay taxes on the income they generate?
So they still have to pay taxes. There are just other regulated or regulatory bodies that monitor that tax collection. And when it comes to mobile food vending, some of the terms, just to explain that a little bit. So a typical mobile food vending unit, there's a permit that is associated with the unit. And then workers on that unit have a license. So there's still a requirement to provide a certificate of authority to collect sales tax on the permittee and their new application. So they're on the record and accept that burden. But that is no longer required of the workers. Some units might have multiple workers and it is somewhat of an administrative burden to obtain that from the state. That's all.
Any other thoughts or questions? Okay, so we'll move to a vote. Can I have a motion to approve the proposed resolution to amend Article 89 of the New York City Health Code?
So moved.
Can I have a second? Second, all in favor? Okay, the motion passes unanimously. And that brings us to the close of this meeting. Thank you so much for your time.
Thank you all.
Is adjourned.
Thank you. Happy summer.
Ashwin, I was just noting that this morning.
Yep, see you on the phone tomorrow.
About and the public health sort of context for Asian Americans and immigrants who are getting. It's just outrageous. And
national chain of Montessori schools.
Well, especially with the new.
Kid in the bathroom. Right. There was a kid in the bathroom and then they lost other.
New York State, but one will definitely be in New York City,
Right?
yeah, and it looks.
I don't know.